Hello, I'm Robert, fact checker and science blogger, and helping people get scared by things such as the scary stories that journalists put out. And this time it's about this new variant, which is getting very alarmist headlines. And I just want to explain the situation. So you get the impression from the headlines that the reason that the cases are soaring in the United Kingdom is because of this new variant. This is not true at all. If you look at the actual data, and this is the actual data from the technical briefing on the first technical briefing on the new variant, then have a very remarkable high R naught of 3.5 in two regions with close to zero proportion of the new variant. And this is over 4 weeks of data, and this is the last of the 4 weeks is the purple ones. And this is a proxy for the amount of the new variant. And so another thing to notice is that if it's so transmissible, why has it taken so long to spread? The first case is way up there with that much of the data is in the 4th week, and back then it's way back here. So it can't be hugely more transmissible. And then if you go and look at the case where you've got the highest R naught, it's close to zero. Indeed, there are other variants that also trigger this signal here. So it's possible that even at the zero of the new variant. And they're talking about a possibility they might increase the R naught by 0.4. Well, even 0.4, it's not going to make a big difference when the R naught is already 3.5 in these regions. And the real reason is because of this. Now this is in Australia, and there's a limit of 100 on the party there, and a group of backpackers from the United Kingdom just ignored the restrictions. And this sort of thing is happening all the time in the United Kingdom. That when we do comply very well with the lockdown, so if you have a total lockdown, people dutifully stay at home. And you get a few people who don't comply, but most people comply. But when it comes to when we're not in lockdown, we don't comply with physical distancing. We don't comply, and people don't seem to understand the thing about ventilation has backfired, and people seem to have got the impression that if you're out of doors, because it's well ventilated, you can talk within 1 metre. That's not true. The ventilation is only for rather rare situations where it's very crowded with lots of people shouting and singing or exercising very strenuously. In that situation, then you need good ventilation indoors. But most of the transmission is through the droplets that are not affected by transmission by ventilation at all. Big droplets go person to person within a metre. You're going to infect other people if you're within a metre, outdoors or indoors. Always step back. And you need to wear the mask outdoors and indoors if you have to go within a metre. This is not understood in the United Kingdom. Not many people know that, the people I try to help. And then we just got very poor compliance. Just people not wearing a mask around the chin or wearing it around their mouth and not around the nose. So many people are not doing things properly. So so first of all, talking to people who are scared, then you can protect yourself, and many of the people I talk to are already doing all this compliance. So there's just two groups of people, including in the United Kingdom, including the United States, that people take this very seriously, and they do everything right. So I'm going to talk to them first, and then I'm going to talk a little bit to the few people, well, it's probably half or so in the United Kingdom and the United States, who just don't take any precautions at all. There's not much in between the two of those. And so for those who are taking it very seriously, then the new variant, then you can stop it just in the same way as all the other variants. And it can't be vastly more transmissible, or it would have been everywhere by now in the United Kingdom. And it does not have a novel way of transmitting itself. It's not airborne. There could be a little bit more. It's not doing anything unusual. It could be this could be explained, if it is true, by a slight increase in the viral load in the nasal cavities, which lead to them explaining a little bit more virus if you're close up within your 1 metre for those big droplets that go across. Then most of the time, if you spend 15 minutes within someone, talking to them close up, even if they have COVID, they're not going to infect you, but then sometimes they will. So people who are not complying with that, then it may be that new variant is making it just a little bit more common that people who are not complying are doing that. And this is just guesswork. We don't know yet. The science is yet to come in, and you can't do the experiments with people. But it seems to be transmitted in the same way. The same ways of protecting yourself will work with a new variant. And it's not even known for sure if it is more transmissible. You can see that the data is very, very noisy. And it's really hard from data they've got so far. So they fit lots of graphs to it and they do modelling. And some people find those models more persuasive than others. And it's going to take some weeks before they tease out how much is due to the new variant and how much is due to other things, such as accidental founder effect is one of many possibilities, where it just happens to be in a group of people. It's like the reason why the variant from Spain spread so rapidly in the United Kingdom. That's not thought to be particularly more transmissible. It was just that people coming back from Spain to the United Kingdom carrying the new variant, they were spreading it more than the people who were native within the United Kingdom with our variant. So there's a lot of things you have to look out for before you can analyse this. It is not known. But it is absolutely clear that that is not why it is exploding in the United Kingdom. It's because of this poor compliance. If you do the good compliance yourself, then you can continue to protect yourself, just as you always have. Just keep doing the same things. And if you are in a situation like in a school where you can't comply because you are not permitted to comply with the measures, and so some of the people we help in the group are still at school, and when they're at school they're not permitted to wear a mask in the classroom, and they're not permitted to do physical distancing, and so very sadly they just can't comply. Even people I help who very much want to comply, and they're just not permitted to. I think that's a scandal myself, that children who want to comply are not permitted to do so in UK schools. But what you have to do in that situation, if you're not permitted to comply with the requirements because you're at school or in some other situation, then just minimise it as much as you can. So for instance, if you are next to each other in a school, don't turn around and talk to your classmate face to face. If you are talking side by side like that, there's much less risk if the droplets are projecting in a different direction from the person you're talking to. And to keep a distance as much as you can, wear a mask where it's permitted, and what you have to do is, when you can't stop it altogether, is just reduce it as much as you can, and you will then be the least at risk child in your school if you do this. And try and encourage other school children to do the same. And then when you go out of the school, a lot of the transmission will be happening outside the door of your school or at home. So in that situation, you can do all the physical distancing because you're no longer bound by the rules of the school. As soon as you leave the school door, you can do any amount of physical distancing you like. Do that. And within the school, do it as much as you possibly can within the premises, as much as is permitted, and you will be hugely reducing your risk of getting COVID. And and the new variant, then if you've been at school, the new variant has been around there since September, and if you've been doing it, and people at school have been protecting themselves since September by doing this, the ones who comply carefully, you just continue in the same way, and you see the new variant makes very little difference compared to all this, and we don't even know it's going to be more transmissible. So finally, I'm just going to talk briefly to people who are not complying with these measures. So, first of all, you may well have got the impression that it's not. First of all, you're probably influenced by the constant appearing of people on television night after night. Whenever we have the BBC News for months on end, we have had the journalists zooming right in on people in the United States who are not doing physical distancing and not wearing masks. Please bear in mind that probably the majority of people in the United States are being very strict in their compliance. the majority of the people I help in the United States, then their question is, how can I keep safe? It isn't, I want to party. Obviously, we get a bit of people who come to us who are scared, but there's certainly lots and lots of people in the United States who are complying very strictly with everything they can find about how to protect themselves. And these people don't appear on the TV news broadcasts. So please bear that in mind. We are herd animals, and we tend to be influenced by what seems to be what everyone's doing, but the journalists home in on that. In the United Kingdom, many people are complying as carefully as they can with the requirements, but again, you don't get that impression so much from the news. So that may help influence you. And then if you think about your friends, then you may be in a lucky cluster. So if you are, especially if your friends are young, or even if you're old, even if you're over 80, then most clusters would say 5 people of over 80 will not have anyone who's died. But then there'll be another cluster where one person has died, and another cluster where 2 people or 3 people have died in that cluster of 5 people. In the same way, if you are a young person in your 20s, most clusters of 5, the majority, not a huge majority, but the majority will have nobody who's had long COVID. But 1 in 3 of those clusters, roughly 1 in 3 for the 80s for the dying as well, then 1 in 3 of those clusters, then one person in the group will have had long COVID for probably 3 months or more. They've just been sick, not be able to do even the most basic things. And if you are in that particular cluster, then you will be well aware of the risks of long COVID. If you're in the other 2 clusters, then you will think, none of my friends have had it, it's all been a mild disease, it's not a big deal. Who wants to have 3 months where you can't push a wheelbarrow, you can't go up a hill, you have difficulty just even going down to the shop and collecting something from the shop? Who wants to do that for 3 months? So think about that, and then you might change your behaviour if you think about that. And then as another possibility, if you're keen on cooking, then many people with long COVID, they lose their sense of taste, and even some things that taste nice to them start tasting horrid. What would it be like to be like that for 3 months? And you just can't enjoy your food, and you are forcing yourself to eat food that doesn't taste of anything or that tastes horrid, because you know you need to eat it to stay healthy. That's another thing that could happen to you. If you're keen on cooking, that's another reason, another very strong motivation. If you have flu or a cold, this can happen for just a few days. With long COVID, this can happen for months. So motivate yourself. And then so I'm assuming now that the people here who are not complying maybe begin to think maybe we should comply. Then what you need to do is to make it automatic. So when you are physically distancing, then it's very difficult if you're constantly deciding, should I physically distance here or not? How strong is the wind? I'll adjust the amount of the wind, or maybe I can go a bit closer because it's windy, or should I physically distance because I'm out of doors, maybe I can go a bit closer. What you need to do is just make an automatic habit, like the way you look both ways when you cross the road. You don't say, should I look right 30 degrees or 60 degrees when I cross the road, depending on the amount of traffic. You always do the same thing. And you might even find yourself doing that in a remote place where you can hear cars from miles away, but you've got in the habit. So it's a good habit to have. So just always look both ways when you cross the road. Well, it's the same way, same thing, that if you're physically distancing, always do that. Just people cross the roads. If you're living in a city, you may cross the road a dozen times a day for years on end. You never get tired of looking out for traffic. In the same way, for as long as this continues, just automatically step back 1 or 2 meters whenever you are socializing with someone. The first minute or so doesn't matter. It seems to take a lot of virus to get to you. You get a few viruses every minute, and then it adds up over 15 minutes that there could be enough get to you for it to start infecting you. Our body can fight off a single virus, it seems. And there's different hypotheses, but that seems quite likely to be the reason why this is. And it can fight off a few viruses without even recognizing what it is. So if you get a 1 minute contact, don't worry about that. Just remember, step back, and then always automatically step back by either 1 metre or 2 metres, make your decision, and always do that. In the United Kingdom, in order to, you should really step back 2 metres, because that's what our government say. World Health Organization say 1 metre is fine. So if you want to encourage other people to step back, it's probably best to follow your government recommendations. If the other person knows about the World Health Organization advice, you could step back 1 metre. But it is really, the main thing is to step back. That's the most important thing. And then, if you're wearing a mask, spend 10 minutes after watching this video, go to the World Health Organization site and find out how to wear a mask. Even including public figures, even the most best known people on TV, they have clearly not spent even 10 minutes learning how to wear a mask. Because you constantly see them, one thing just about everyone does, is they're constantly fiddling with the front of the mask. They're touching it, moving it up and down, adjusting it, just fiddling with it for no reason even. You should never touch the front of the mask after you put it on. These people have not spent 10 minutes learning how to wear a mask. And so just about everyone on television that you see on television hasn't learned how to wear a mask properly. Luckily, even with very sloppy ways of wearing a mask, it does protect us. That was quite a surprise, and that's why the World Health Organization changed their advice on masks. But why not wear it properly and get the best possible protection for your mask? Also spend 10 minutes learning how to wash your hands. You might think, I know how to wash my hands. It's very easy. But if you go and watch how Dr. Tedros washes his hands, then you will discover there's a lot more to it. The thing is to get the soap everywhere, between the fingers, back, front, around the thumb, under the fingernails. Develop a routine so that in 20 seconds you can do all of that. So just learn how to do all that in 20 seconds. Spend another 10 minutes just learning how to do that. If you have a case in your house, then with COVID, then think about it. And some of the people watching this may have a case of COVID in their house right now. What would you feel like going into a ward full of COVID-19 cases? Think about health workers and how they put on personal protection equipment. You should protect yourself in the same way, looking after COVID-19 cases at home. It's no different from a ward of COVID-19 cases. And you are not likely to have it yet. It happens it spreads to rare super spreader events that have probably not happened yet. So if you have a case with COVID-19 right now in your house, or you are a case, look up how to look after a case with COVID-19 in your home with the World Health Organization, because sadly in the United Kingdom they're not explaining it properly. They're making it seem much easier than it is. Find out how to do it properly. Look up how to do it properly and do that properly. That will, in maximum protection of your household. 80% of transmission is in the household. Only 20% is stopped by lockdown. And then if you are a case, again, the contact tracers probably won't get to you. They're way overworked. Look out for who you've been in contact with for the last couple of days. Do get tested if you have the symptoms. Don't hesitate about getting tested. If you are a case, then you need to look at who you've been in contact with without physical distancing for the last 2 to 3 days, 2 days probably, and then ring them up and tell them and try to get them to be aware of the good information on quarantine from the World Health Organization. Look up how to quarantine properly. Again, it's not being explained very well in the United Kingdom, and most people I talk to have no idea how to isolate if you're a case or how to quarantine. So find out and learn yourself how to do all that. The information is all out there at the tips of your fingertips. You can find it in a few seconds. I've got links in some of my articles. You can quickly find out what the World Health Organization advice is on how to isolate and how to quarantine. So do that. And so if we all do that, and might follow all the advice on how to do it, then it'll just go off a cliff if everyone did that, and we'd soon be like New Zealand. And anyway, so I'm going to stop this at 20 minutes, But I do see, I've said in a slightly longer video, it's not even that much longer than this one, but so I'm doing a second video because I think this may be a better way of explaining it. So I think there's good prospect that in the future Jacinda Ardern, with talking directly to the people, then she managed her style and following the science and not arguing with the science. The science has been so politicised in the United States and in the United Kingdom, where we have our Prime Minister arguing with the doctors basically on the medical advice, and they say to do one thing, he does another thing. And the Jacinda Ardern is worked with the scientists all together, and that's what you need, all society, all of government approach, and we need that. And I think it looks like Biden is going to do a similar approach to Jacinda Ardern, and he's going to talk directly to the public. He's going to talk directly to the public, heart to heart. He's going to follow the science. He's not going to be arguing away and saying, well, for political reasons, I'm not going to do what you just said. And work with the science. The science is very good. We know how to stop this. The US CDC is excellent, but the president hasn't been following their advice. He's been part following it, part not following it. And that is why, and so we will see for the first time, starting January 20th, what happens in the United States when you have a leader who talks directly to the people, like Jacinda Ardern did in New Zealand, and who follows the science, and follows the science very carefully. And the evidence from New Zealand is that when you do that, the cases drop off a cliff like that. They drop tenfold in 25 days. And so I think we're going to see that in the United States as well. And it just makes sense, and people who are not mask wearing, once they have it properly communicated, like a consistent message from the top, with everything reinforcing it. It's not propaganda, it's just presenting the true situation very clearly. Then I think we're going to see them starting to comply properly, and it'll just go off a cliff in the United States, just like it did in New Zealand. So I personally am very hopeful, very optimistic about the future. And meanwhile, then we have the vaccines coming in, and it's going to reduce the mortality and going to reduce the number of people in ventilators, but not immediately, because you've got the delay, even though there's some protection straight away with the Pfizer vaccine, more than expected even with the first dose. That's not going to have any effect till sometime in February, because of the time delay between infection and then showing symptoms, and then 3 weeks or more before the first deaths. And the build-up of the intensive care units is about a similar timeline. So the vaccination they're doing right now, we should see the deaths and the ventilators starting to fall off a cliff already in February to March. So that's the first step, positive thing that's going to happen. It's going to be delayed by a month or more. And then if it's the second dose, that's in March. The second dose is going to start having effect on deaths and ventilators. And so we do have that, and we also have the, if they start doing the effectively public measures on the 20th of January, then again, that's going to be February, March time, the cases would start going down about 2 weeks later. So that would be middle of February, we can expect cases to start going down from public health measures. The cases are going down in the United States already in nearly all states now, I'm very pleased to see, all except 6. So he will be starting from a level of the cases going down a bit, and then it should go drop off the cliff, I think, because just by the analogy of what happened in New Zealand and in so many other countries that have done very effective public health responses, such as Taiwan, the whole of China, Laos, Vietnam, and then Australia has managed to reduce it almost to nothing as well. So let's hope that the United States, and it's a realistic hope, realistic prospect that it'll just drop off the cliff too, sometime in early spring. So anyway, I'll stop that now. I think this is a better video, so I'll make this one. I'll unlist the previous one, and I'll make this the one. So I just want to say that just a shout out for our group, Doomsday Debunked. And if you are good at fact checking, and especially if you're an expert, if anybody watching this is an epidemiologist and has a bit of time, or expert in any of these areas to do with COVID-19, or virologist, and you have a little bit of time to come and talk in our group and help people there, then we very much welcome any expertise, anyone who's got a bit of time to help. We have some people who have levels of expertise in various topics. Then we have the general fact checkers, and then if you're good at fact checking, or if you have expertise in particular areas, then it's really, you can help lots of very scared people in our group that are trying to understand and trying to, and the people there are very careful about COVID-19, but they're still scared, and we say many other topics that. So just a shout out to our group for if any of you are good at fact checking, and in any topic, any of these scary stories, climate change, asteroids, many different topics, then we very much welcome people who've got expertise who can help. People who are general fact checkers. I'm a general fact checker here, so through my science blogging, and through my postgraduate work in maths, and I know how to understand. I understand how to do fact checking, and so I know where to look things up. I'm not an expert on any of this. I just know how to check the facts properly. But good fact checkers are very useful, and also if you're good at working with people who are autistic or who have bipolar disorder, not to obviously therapy, but just communicating effectively with them, then and things like advice clinic where you can go for help. And then it turns out that a very high proportion of people who get most scared by things like this are ones who are autistic or who have bipolar disorder. We've discovered that it's not empirical research. It's just what you call it. We've noticed that a very high proportion, much higher than general public, than in other groups, are autistic in our group, and or have bipolar disorder, and these conditions seem to make you much more vulnerable to these sort of fears of these things. And then, but we're not offering therapy. We help them get in the direction of finding therapists where we possibly can, and we just do the fact checking. So if you're good, and if you're just an empathic person and good at talking to people who are scared, and just help them on a human-to-human level of just listening to them, and helping and listening to their fears and letting them express themselves, and then help them as well as trying to help them bring contact with people who can do the fact checking for them. So that's how. And then of course, if you want any of the scared people, then do please join our group. And well, if I give a shout out to our group, it may be what you're looking for. And then there's my blog, Quora blog, and this is one of the Quora blog posts. I just spent all the time on that diagram, but I'll just show you the blog post itself. And there it is. New variants of COVID are the same disease. Protect yourself in the same way. Continue to do it all. No evidence it is more severe or evades vaccines, and tests find it. So I didn't go into those things. Probably most of you know that already, but the article explains that as well. Okay, so I'll stop this. It actually ended up a little bit longer, but I think a rather clearer version than the previous one I just uploaded.